Good morning, I am Dr. Seema and today we will learn about Histology of Female Reproductive System Part 1, which includes ovary, fallopian tube and uterus. Specific learning objectives of today's class. At the end of the class, students should be able to define and enumerate the different parts of female reproductive system, describe the structure and function of different parts of female reproductive system, and last one, list the identification features of different parts of female reproductive system. I just want to tell you once more, we are dealing with only uterus, ovaries and fallopian tubes. Female reproductive system includes internal genitalia and external genitalia. The parts of internal genitalia includes uterus, fallopian tube, ovary and vagina. And this is the coronal section of the same, and you can even see the cavity of the uterus. This is uterus and this is the cavity of the uterus. This is fallopian tube, ovary, and the lower part of the uterus is called as cervix, and it is protruding into a thin muscular tube which is called as the vagina. Now we will see the function of each part in brief. Ovary releases the female gamete ovum and it produces two important hormones needed for the development of female reproductive system, that is estrogen and progesterone. The released ovum will be taken by the fallopian tube through its abdominal ostium. The fertilization of ovum and sperm occurs in the ampulla of fallopian tube, and the early phase of development of the embryo begins from here. Fallopian tube moves the fertilized ovum towards the uterus and provides it with the adequate nutrition. The fertilized ovum, that is the developing embryo, will be entering the uterine cavity through the uterine ostium of the fallopian tube, and it gets implanted in the posterior wall of the uterus, which will be in its secretory phase by then. And if the fertilization does not occur, the uterus will then go into its next stage, that is the menstrual phase, where most of the endometrial tissue will be shed out along with the ova. And after that, it will be going to its third phase, that is the proliferative phase, where there will be regeneration of the shed out endometrium. So in this particular session, we will be learning two stages of uterus, that is proliferative stage and secretory stage. First, we will see the histology of ovary. This is the outer surface of ovary. So from outside to inwards, we have four layers. The first layer is the germinal epithelium. Deep to that, you have a connective tissue layer which is called as the tunica albuginea. Deep to that, you have the cortex of ovary, and still deeper, you have the medulla of ovary. This is the germinal epithelium, which is the outermost layer of the ovary, and it's a misnomer because it cannot give rise to any female gametes. And it is a modification of peritoneum lining the ovary. It is formed of a single layer of cuboidal epithelium. Now, deep to that, what you see is the tunica albuginea, which is made up of connective tissue, and it is white in color. That's why it gets the name tunica albuginea. Comparing to the tunica albuginea of the testis, it is thinner, and it consists of blood vessels, nerves, and lymphatics, etc. Deep to germinal epithelium and tunica albuginea, we get the main constituents of the ovary, that is cortex and medulla. So you can clearly see here, cortex is placed outside and medulla is placed inside. That means an inner medulla and outer cortex. That is the most important identification point of ovary. Now to see in the cortex, you can see connective tissue stroma in which various stages of developing ovarian follicles are dispersed. And in the medulla, you are getting loose connective tissue which involves blood vessels, lymphatic vessels, nerves, etc. For writing a short note and for discussion purpose as well, we should know the different stages of ovarian follicle development in brief. So, the development of ovarian follicle begins as a primordial follicle, then it goes to primary follicle, then comes the secondary follicle, then tertiary or Graafian follicle, then comes the ovulation, and when the ova is released, the follicle will be folded to form the corpus luteum. Then it later turns to corpus albicans, and atretic follicles are those follicles which could not become Graafian follicle and which in between got atrophied. Primordial follicle. At the time of birth, the ovary will be having only primordial follicle, and it will be almost about 1 million. And the primordial follicle mainly includes a primary oocyte arrested in prophase of first meiotic division, and it will be covered by a single layer of flat follicular cell. And these follicular cells are nothing but they are the stromal cells only, but they are called as follicular cells because in future they will be forming the follicle of the ovary. And no new primordial follicles are formed after birth, and they remain in this particular stage as primordial follicle till puberty. And after puberty, every month few primordial follicles enlarges, and ultimately one ova will be released from one Graafian follicle, and this cycle continues every month till menopause. The primordial follicles soon evolves into primary follicle. There is not much change in the oocyte. They will be still in the primary oocyte stage, and the lining, and it will be soon covered by the zona pellucida. And the covering epithelium was earlier squamous cell. Now in the primary follicle it will be changing into a single layer of cuboidal cell. And this is the early phase of primary follicle. In a late phase of primary follicle, the single layer of cuboidal cell will be multiplying, and they forms many cells around it. And this will be the late phase of primary follicles. And this multi-layered cuboidal cells around the zona pellucida will be called as the granulosa cells. Soon the primary follicle will be converted to secondary follicle. Now in a secondary follicle, the granulosa cells which was covering the primary oocyte will be having small fluid filled cavities, and they are called as the antrum. So once this antrum appear within the granulosa cells, we will be calling it as secondary follicle. And this fluid is mainly secreted by the follicular cells itself to nourish the developing oocyte. And there will be, in addition, there will be two more layers which is called as the theca interna and theca externa. The theca interna is mainly formed of connective tissue, that means the stromal cells. You can see live stromal cells in it, which will be later producing the estrogen. And outside the theca interna layer, there is one more layer which is called as the theca externa layer, and here there will be only the connective tissue. The secondary follicle will be soon converted to tertiary or Graafian follicle. Now we will see what are the changes occurring in a Graafian follicle. You can clearly see that the fluid-filled cavities or antrum which was present in between the granulosa cell have increased its size, and the oocyte is pushed towards eccentrically. And here the primary oocyte is converted to secondary oocyte. That means the first meiotic division will be completed, and the secondary oocyte is formed, and it is arrested in the metaphase. And this occurs just before ovulation. And you can see the follicular cells which are surrounding the secondary oocyte has become very thin. And the secondary oocyte is connected to the remaining follicular cells by few cells of the follicular cells which are called as the discus proligerus. And in front, these cells will be called as the cumulus euphoricus. And the inner cells of these will be called as the corona radiata. And this corona radiata will be released along with the ova during ovulation. Once more, we will see the different stages of ovarian follicles. This is the primordial follicle with the primary oocyte surrounded by a single cell of follicular cells which is squamous in shape. Soon it will be changed to the early phase of primary follicle, where the squamous cells will be changed to a single layer of cuboidal cells. Now it enters the second phase or the late phase of primary follicle, where the single layer of cuboidal cells will be converted to multi-layered of cuboidal cells which are called as the granulosa cell. Now the next secondary follicular stage you can see here. Here this is the granulosa cell, and it will be having antrum or fluid filled cavity. And this is the tertiary or graphene follicular cell stage, where the antrum has become enlarged in size and the oocyte is converted to secondary oocyte and it is moved eccentrically. After ovulation, the follicle collapses and becomes folded to form the corpus luteum. And if the released ovum fertilizes and the pregnancy results, then the corpus luteum lasts for at least 3 months and secrete progesterone. If no pregnancy is there, means what happens is like the corpus luteum will be regressing and it will become corpus albicans. In the ovarian cortex, other than the different stages of ovarian follicle, we will be seeing one more type of follicle which is called as the atretic follicle. Now what is this atretic follicle? Each month, a number of primordial follicles develops into different stages of ovarian follicle. Among these, only one attains the full size and becomes the matured graphene follicle and releases the ovum. All other follicles will be then degraded or degenerates to form the atretic follicle. And later they become the corpus albicans. In your histology record, you will be drawing the ovary section in this way with all the different stages of ovarian follicle. Fallopian tube is otherwise called as uterine tube. It is having two openings, one at the lateral end and other at the medial end. The lateral end opening opens into the peritoneal cavity and the medial end opens into the uterine cavity. And from medial to lateral, it is divided into 4 parts. First part is the intramural or uterine part. Second part is the isthmus. Third part is the ampulla. And the fourth part is called as the infundibulum. Now we will see the histology of fallopian tube. The fallopian tube is made up of 3 layers from inner to out. The first layer is the mucosa, the second layer is the muscular layer, and the third layer is the serosa. And you can see very clearly that the mucosa shows numerous branching folds that almost fill the lumen of the tube, which is a peculiar feature of fallopian tube. Mucosa of the fallopian tube consists of epithelium and lamina propria, and it lacks muscularis interna. And as I already mentioned, you can see it very clearly here. The mucosa is folding and almost fills the lumen of the fallopian tube. The lining epithelium of fallopian tube is simple columnar epithelium. Few of the cells are ciliated and which will be helpful to move the fertilized ova towards the uterus. And some other cells are non-ciliated and they are called as the PEG cells. They are secretory in function and they will be nourishing the fertilized ovum. This is the electron microscopic view of epithelium of fallopian tube. Here you can see the ciliated cells and this is the non-ciliated PEG cells. Now this is the H&E section of the fallopian tube, and what you see here, this is the lining epithelium which is having both PEG cells as well as the ciliated cells. Underneath you are seeing is the lamina propria. The muscle coat of fallopian tube consists of 2 layers, the inner circular layer and an outer longitudinal layer. And outer to this muscular layer, the last layer is the serosa, which is mainly consisting of a connective tissue layer, and over to that there will be peritoneal lining. These 2 diagrams are H&E sections of fallopian tube, and you will be drawing this section in your histology record with the lumen and all the 3 layers covering it. Uterus is the childbearing organ in female, and it consists of 2 parts. The upper expanded large part is called as the body and the lower cylindrical short part is called as the cervix. This is the lumen of the uterus and you can see it is very narrow, and the wall of the body of uterus consists of 3 layers. From inner to out it is the endometrium, then myometrium, and outer one is the perimetrium. Endometrium is the mucosal lining of the body of uterus and it shows cyclic changes. The lining epithelium of the endometrium is simple columnar and the underlying lamina propria consists of uterine glands and spiral arteries. Endometrium has two layers. The superficial thicker one is called as the functional layer, and this layer alone gets sloughed at menstruation, and the lower deep and narrow layer is called as the basal layer, and after sloughing of upper part of the endometrium during menstruation, this lower basal layer will be regenerating the functional layer again after each menstruation. Now we'll just compare the endometrium of proliferative phase and secretory phase. We can very clearly see that the endometrium is thicker in the secretory phase comparing to the proliferative phase. And now just beneath the epithelium what you are seeing is the uterine glands. The uterine glands are straight and long in proliferative phase, and they are widely separated, and their lumen is narrow and their secretion is less in proliferative phase, whereas when you compare it to the secretory phase, they are more coiled and they are more in number, and they are almost sawtoothed appearance, and they are very closely placed. Then if you compare the lumen, it is very wide and the secretion is more. Now we'll see the spiral arteries. You can see it is less coiled in proliferative phase and it will not reach up to the lining epithelium, whereas in secretory phase they are more coiled and they reach even up to the lining epithelium. And the one more difference is like the endometrium will be fluid filled and edematous in secretory phase, whereas in proliferative phase this edema will not be there. This is one more section of different stages of uterus in proliferative and secretory stage. Again HND staining, and very clearly you can see the difference between the uterine glands in both stages, like in proliferative stage and secretory stage. And mostly it will be easy for you to identify the two slides looking at the endometrium of the two stage. Myometrium is the thickest layer and consists of compactly arranged smooth muscle bundles. They are arranged in three layers. There is the inner and outer longitudinal layer, and in the middle there is a spiral or irregular layer. And the smooth muscles of myometrium is capable of hypertrophy and hyperplasia. And outer to that, the third layer comes, that is the perimetrium, which is a vascular connective tissue lined by peritoneum. The lower cylindrical part of the uterus is called as the cervix, and you can see here this is the cervical canal, and it is very narrow, and this is the cavity of the uterus. So the junction between the cavity of the uterus and the cavity of the cervical canal is called as the internal os, and this is vagina. And you can see here the cervix is protruding into vagina. So it is having two parts, a part which is protruding into vagina and a part which is above the vagina. So the part above is called as the supravaginal portion, and below is called as the intravaginal portion. So the junction at which the cervical canal is meeting the vaginal canal is called as the external os. So the cervix is having an internal os where it meets with the cavity of the uterus, and it is having an external os where it meets the cavity of vagina. The structure of the cervix of the uterus is different from that of the body. Here the mucous membrane is called as endocervix, and it has got oblique folds which are called as palmate folds, and the cervical glands are highly branched and they are tubulo-alveolar in nature, and they secrete mucus. Compared to the uterus, the muscle cord is very thin, and the lumen of the cervix, as we are told, it is called a cervical canal, and it is very narrow, and it has got a great ability to dilate, and this is mainly because of the presence of elastic fibers in the muscle cord. If you see the lining epithelium of the cervix, the endocervix is lined by tall columnar cells, but when it comes to the ectocervix, that means the part which protrudes into the vagina, will be lined by stratified squamous epithelium. These diagrams are H&E sections of cervix, and here very clearly you can see the squamo-columnar junction. So this is the lining epithelium, which is simple columnar epithelium, and you can see here it is changing into stratified squamous epithelium. Thank you and have a nice day.